Welcome. We're very excited to have you all here today. Wherever you're calling in from, good morning or potentially good afternoon, good evening. Um, I had the pleasure of hearing some of these stories earlier this week, and I just wanted to share that you are in for a treat. There are some really great presentations that we're going to hear today. So I really appreciate everyone taking the time out of their schedule to join us. Just a little housekeeping before we get started. We're going to run our Q&A a couple of different ways. Of course, we encourage questions throughout. If you have something, please drop it in the Q&A feature or the chat on your Zoom because we don't want you to forget it. We're going to hold most of the Q&A towards the end. But because we have 4 different presentations from our nursing students, and they're all so incredible and exciting and different, we're going to take a brief pause in between each one. This will allow you to ask that specific student a question if you have something that you want to address in that conversation, so it's not forgotten before the end of today's session. Before we get started, I want to introduce you to our USD faculty who's with us today, who has been gracious enough to put this presentation together. Helene Heggie has been practicing nursing for over 35 years. She has practiced in many different clinical areas, including as the primary RN in a rural clinic for 10 years. While working in the rural clinic, Ms. Heggie obtained her Master's of Nursing Education. She has been a nurse educator at the University of South Dakota for the past 10 years. Also with us today is Dawn Warren. Dawn has been a nurse educator for the University of South Dakota for 29 years. She has worked in emergency and critical care nursing, but her biggest passion and joy is working with undergraduate BSN students. She thoroughly enjoys being a part of the HRSA grant, in which she works with students in rural South Dakota. So now what I would like to do is turn it over to our presenters to take you on this journey this morning.
Well, thank you, Stacy, for that introduction. And we'd like to start off our presentation with just a little reminder for those that maybe weren't in on our last presentation, a little bit reminder about the objectives of our HRSA grant experience and our partnership. So we'll be explaining more about it in a little bit, but we're going to move on to the next slide that talks about what the objectives of this project has been. So the objectives of this presentation that we are having today and a little bit about our project is we're going to review information about our grant. We're going to talk about how collaboration and communication are so important with our patients and the care that is provided in these rural health settings. We're going to discuss how participation in person-centered care nursing across the lifespan has established just really solid relationships to provide quality care. We'll also identify how prioritization of care and clinical nursing judgment were needed by our students to improve and optimize our patient outcomes. And then we're going to explore challenges in healthcare delivery in rural communities across the state of South Dakota. So with the next slide, Stacy, I'll have you talk a little bit about our partnership.
Well, thank you. For those of you who may be unfamiliar with GRNEN, I do believe everyone here has visited us at least once. Our mission is to connect nurses, students, educators worldwide who share a passion for improving the health of rural communities. We do this through our website, which hosts discussion forums and facilitates collaboration. We bring together presentations and webinars like this, and we have a lot of other resources that we're constantly bringing forward to unite our community and champion the role in the rural nurse. The partnership between GRNEN and the University of South Dakota is new this year, and it's one we are incredibly excited to be have the opportunity to work with. So our goal here is to help the University of South Dakota with their HRSA grant program and bring it to a wider audience. This is a really interesting immersion experience. And by sharing these student opportunities, we're hopeful that we can encourage other students and other educators to bring that rural environment into the classroom, to make those introductions and hopefully champion future rural nurses and ignite some passion in our students to choose a rural career and to also offer our educators the opportunity to bring some rural component into the classroom as well.
Hello, everybody. As she said, my name is Dawn Horn, and I'm delighted to be with you all today. Our students have done a fantastic job with this grant experience, and we're excited to have them share their stories. For those of you who have never been in South Dakota, or I just wanted to take a little bit of time to tell a little bit about our state. So Helene is going to tell you a little bit more specifically about the grant, but one part of the grant involved the students going into a clinical site somewhere in South Dakota, and they were all very rural, underserved areas. So this is a map of the state of South Dakota. The entire state only has a total of 858,000 people. So we're one of the most rural slash even frontier states in the United States. We do have 9 tribal lands, so we have a lot of Native American people in our state that we have been delighted to work with and do a lot of recruitment with. We have two major urban areas. So on each end of the state, you can see there Rapid City on one end of the state, and then take the interstate all the way down, and the other end of the state is Sioux Falls. Those are really only our two only what's considered urban, and they're still not really huge. Everything else is very, very rural. For those of you who've maybe heard of Mount Rushmore in the Black Hills, that is one of the things that we're known for in South Dakota. It's a very beautiful area of South Dakota that a lot of people travel here for. And then we also have the Badlands National Park, which is another beautiful area that's kind of unique to South Dakota. By far, though, the biggest part of our state is agriculture, a lot of farming and a lot of ranching. And you'll hear the students talk a little bit about today, some of the things that are unique to the area just because it's such a rural state, but has brought them a great learning experience. Okay, next slide.
So the next piece we're going to talk about is the work that these students have been doing and how this came about. And so the part of the grant that we'll talk about is the experiential learning. So Dawn and I have had the honor and privilege to be the clinical coordinators of this grant and the work with the students. So our goal is to increase the student awareness, interest, and competency by placing them in rural and underserved communities. So how that has come about is Dawn and I have, as I said, had the privilege and the honor to go out to many rural communities across the state of South Dakota to identify hospitals and settings that our students could come and work in. And so then we have gone and talked with the students and asked for students, for volunteers to participate. Through the grant also, they get paid a stipend of $2,000, plus they get paid their mileage and their meals for the experience. So then they go out into these different communities. So today you're going to hear stories of 4 students that have gone out into 4 different rural communities and the experiences that they have had. And remember, our goal is that we wanted to increase their awareness, their interest, and their competency in the care of the people in these rural areas, and identify just the uniqueness about these communities, and also at the same time immerse them in these communities so that they understand what it's like to live and be in a rural community, and all of the great experiences and all the extra bonuses and benefits that come from working in your community where you know the people that are there and you develop those relationships. So As Stacy shared, we're really excited about the stories that you're going to hear today. And we also just appreciate the relationships that we've made with these rural hospitals and the willingness of these rural hospitals for accepting our students and making them feel a part of their team as well. And so now we're going to move on to hear about the stories. And so the first place that we're going to head to is to Canton, South Dakota. And so Rebecca will be introducing herself and sharing about her experience in Canton, South Dakota. So Rebecca, I'm going to hand it over to you.
Well, hi, as Helene said, my name is Rebecca. I'm a fourth semester nursing student at the University of South Dakota at the Sioux Falls campus. I'm originally from Iowa City, Iowa, and I'm a non-traditional student. I originally got a degree many years ago in advertising and marketing at Iowa State University in Ames, Iowa, and I worked for quite a while in the field of advertising marketing, and I did some administrative work as well. And then through some happenstances in life, I ended up caring for a family member that had terminal cancer. And so I was his primary caregiver, and I spent a lot of time in the hospital. I spent a lot of time doing home health care for him, feeding tubes. I got experience with trach care and suctioning. I'll medication administration, all sorts of things. And so through that experience, I got interested in the nursing field. I then ended up starting nursing school at the University of South Dakota in my 50s. And I'm enjoying it. I'm graduating in a week and I'm excited. I'm going to pursue a career as a wound care nurse. So if you're not familiar with wound care nurses, generally they're employed in a hospital and they travel throughout the hospital to different patient rooms, assessing wounds. They might be pressure ulcers, they might be surgical incisions, they could be from trauma, some kind of laceration. The wound care nurse assesses the wounds and tries to promote healing and prevent infection. So that will hopefully be the area that I will concentrate on when I graduate. For the clinical experience for the HRSA grant, as mentioned, I was in Canton, South Dakota. And Canton is a small rural community. It's a population of about 3,000 people. And the hospital that I worked in there as a preceptee is the Canton Inwood Hospital. Canton is in South Dakota and Inwood is in Iowa. They're just kind of right across the border of the two states. And Canton is located about 30 miles south of Sioux Falls, South Dakota. Actually, the Canton Inwood Hospital is an 11-bed hospital. There's also a emergency department that's open 24 hours. There's a clinic that's open during the day, like 9 to 5. And attached as well is a elderly care facility, assisted living facility. So as I mentioned, Canton is a farming community. And so we did see a number of farmers and their families as patients. We saw farming related emergency room clients visiting us for things like sheet metal lacerations, and wounds that they got from some kind of farming equipment. We did see some patients with back injuries from lifting, doing some repetitive heavy lifting on the farms. And then, of course, we saw all sorts of other patients. We had inpatients with pneumonia. We had inpatients who were just doing some strengthening and rehab. We really took care of a lot of different patients. However, being a small rural hospital, of course, we didn't have the extensive diagnostics. We didn't have a MRI or CAT scan. We did have radiology with x-rays, and we did have a laboratory, but anyone that presented with some kind of a critical illness, we usually would just, if someone came, let's say they had a symptoms of perhaps a heart attack, we would stabilize the patient, get some IVs going, give them whatever meds the primary care physician ordered, and then we put them in an ambulance or helicopter and send them up to the larger hospital in Sioux Falls. One thing the hospital there did that was a great service to the community was they did do daily infusions. So we had cancer patients there getting some fluids. We had other types of patients needing antibiotic therapies in the hospital on a daily basis. They also did provide bi-monthly colonoscopy and mammogram services. So that was nice for the rural community to have those things there where they didn't have to travel all the way to say Sioux Falls to get those services done. I did mention that it is a farming community and that I did have patients that were from farms. One patient that comes to mind for me was a gentleman who had been up to the larger hospital to the orthopedic physicians in Sanford at Sioux Falls. He had gotten a total hip arthroplasty, and he had gone back home to his farm, which was somewhere located south of Canton, I think maybe 50 miles. And he was having persistent wound drainage, which, as we know, it was several days post-op, and your wound should not be draining several days post-op, certainly not to the degree that his was, saturating several like 4x4 gauze pads daily. And of course, we worry about infection as well. So he came into us in the emergency department, and we admitted this gentleman and started some antibiotics and got the labs going. So we got some wound cultures and blood to test for signs of infection, basically. Then, because we didn't have specialty orthopedics on our staff, we were in communication with the larger hospital that we were affiliated with, that's Sanford and Sioux Falls, and we ended up transferring him up there the next day where he got some wound care. He got some, they opened him up and they did some debridement and irrigation of that wound. And then consequently, a couple days later, he was sent back to us. And one thing that was also part of our rural hospital and unique is that they have a service called swing bed. And what that means is that the patient can change from, or the patient, I'm sorry, the room rather, can change from an acute bed status to a rehabilitation status. So he came back to us and stayed for a few days just to as a rehabilitation patient. And again, that's just a nice service that the rural hospital provided because otherwise there were no rehab centers anywhere near where he lived, or nor were there any others in Canton. So he would have had to stay in Sioux Falls and be transferred to a rehab facility because he no longer really fit the qualifications to need hospital care, inpatient hospital care. And that was a nice service because then his family and friends could visit him and travel the much shorter distance to Canton daily than having to travel back and forth to Sioux Falls. That was a great patient satisfier for his family. I could tell they were happy that they were able to see him more often and obviously much more easily. And with discussing that kind of collaboration amongst our hospital and the larger hospital, collaboration in general is something that I did see a lot of working in the rural hospital. Everybody just has takes on a little more responsibility. Your roles are extended, definitely. A nurse may end up doing a little bit of dietary, or our pharmacy was only open limited hours. And so we had access to the little pharmacy in the hospital. We would go in and pull our own meds off the shelf or even formulate some medications. So, definitely duties that normally a nurse in a larger hospital wouldn't be taking on. Also, depending on the census of the 11-bed hospital, we may or may not have a patient tech on staff. So we ended up also doing some of the ADLs. We ended up, bathing the patients, assisting them with their toileting and their other feeding, other types of activities of daily living. So just something that I found was very, unique to the rural environment. And that kind of collaboration, I think, was great for the patients. They kind of got a more familial atmosphere. We tended to see them day after day. You basically saw all the patients during your shift, so they got to know you and you got to know them. And that was, I think, a rewarding experience all around. So I would definitely suggest working in a rural hospital to anyone interested in healthcare. It is a unique experience, very dynamic, exciting, and something I definitely enjoyed.
I'd like to open up the Q&A or the chat for any questions that you might have for Rebecca, either about her experience or something specific that she shared with us today. We won't take too long here because we will have Q&A at the end if something pops up later, but this is a good time to just grab Rebecca really quick. No.
I have one real quick, Rebecca. If there's any challenge, if you could say there's one of the biggest challenges of being in that small rural facility, what would you say it is?
I would say probably just probably the lack of resources. You do have to be very resourceful and quick on your feet. You're not having the larger staff that you would have at a big hospital, and the specialty interdisciplinary specialty people to help you out. So you do have a little more responsibility.
Yeah, makes sense. Okay, thank you.
I do have one question that's coming in. Kathleen's asking, did you live in the community during your immersion, or did you commute from the university?
I actually commuted from the university. Some of my peers did live in the communities, but that was not an option for me. And so I did make that commute twice daily.
Okay, well, thank you so much, Rebecca, for sharing your story. We could just feel the passion that you have and the positive experience that you had at the Canton Inwood Hospital. And again, we just thank the hospitals as well, and the Canton Inwood Sanford Hospital for being so inviting and also willing to participate in this experience and allowing our students to come to their hospital to get this experience. So hats off to them as well. And hats off to you, Rebecca, for representing nursing in the clinical setting. So thank you for sharing your story. We're going to move on now to the other side of the state. We're going to the western side of South Dakota, to Hot Springs, South Dakota. And Allison will be sharing her experience that she had at the Hot Springs Hospital. Thank you, Allison.
My name is Allison. I am from Burke, South Dakota, which is also another site for the HRSA grant. It is a rural town with a population a little less than 600, and they just built a new hospital a few years ago. But I did my experience in Hot Springs, South Dakota at Fall River Health Services. Hot Springs is in the southwestern part of South Dakota, and it has a population of about 3,500 people. There is a lot of elderly people, veterans, and a large homeless population. With that, there is a large amount of mental health issues and substance abuse. While there, I went back and forth between the emergency department and the inpatient hospital side. The emergency department has one trauma room, one isolation room, and then just two regular rooms. And the hospital has a 14-bed maximum, which does decrease if they accept any patients that have any sort of drips. Like they don't accept a lot, but they will take people with like cortisone drips and stuff like that. But they do decrease their amount of beds that they take then. Um, Patients that you see there typically are for like long-term infusions that they can't make the commute, or there's a lot of swing bed patients. Um, but I also did get to follow the outpatient nurse for a little while I um, while there weren't any patients in the emergency department. So while following her, I got to help with outpatient infusions, and she also does a lot of outpatient wound care. So those patients will come in whenever they're scheduled, and she'll take care of things like that, like if they have any type of wound vacs or anything like that, so that they don't have to travel. Um, Hot Springs Fall River Health Services is a critical access hospital with the nearest hospital that accepts major issues being over an hour away. Um, let's see. The emergency department, um, being the nurse in the emergency department, you have to have a lot of clinical judgment and use your autonomy, especially on night shifts. With there only being one nurse there, and the other nurses or paramedics that go home at 11. So after 11 until 6 a.m., there is only one nurse there, and then security, radiology, and lab, pharmacy, all of them have left by then as well. So if you need a med, most of the time you have to, or a med that requires mixing, most of the time you'll have to mix it yourself. If there isn't anything in the Pyxis, you'll have to go to the pharmacy and grab that. Um, Also, there is walkie-talkies and a radio that you have to listen for, which is to the ambulances like from a town away, and then the one also in Hot Springs, just so you can have a heads up of what might be coming in. And then you can know to call in radiology and lab, and then the physicians. There are a few that live in town, and then there are also a few that live outside. But the ones in town typically will go home when they're on call, and then just wait to get called in. And then the ones outside will stay in the call room, but you still have to go and let them know that someone's coming in. Um, so one of the experiences that was there was a pregnant patient that came in, and Fall River Health Services does not usually take births. Like they like to transfer them to Rapid City if possible. Rapid City and Fall River Health Services has a contract where Rapid City cannot decline any patients coming from Fall River. So they loaded her up to the ambulance since it did not look like she was going to birth soon, but things escalated quickly. They got to a gas station and she was crowning, so they turned around and had to come back. Um, so they ended up delivering her in the trauma room there. But it is not something that they typically like to do at all, since they have very few nurses that have any experience with labor and delivery or possible NICU care, anything like that. So just uh, instances like that, or big traumas, they usually will come to Fall River to stabilize, and then as soon as possible, they will transfer to Rapid City.
Thank you, Allison. We'll take a quick pause again if anyone has a quick question that they would like to share or ask.
While people are typing, I'm just curious about, you said there's a lot of homelessness and a lot of trouble with addiction issues. So are there some resources there to help with that? Or, I mean, is there a place they can go, the homeless people, or how do they help those people out?
Unfortunately, there are very few resources for that in Hot Springs. Um, there is a detox facility there. There are a couple other clinics and stuff as well, but there isn't a lot of resources. Hot Springs is kind of isolated as well. So, and it has no form of like public transportation or anything like that. So, unfortunately, no, there's not a lot that they can do.
Thank you.
I have a question. Dawn is asking, did you use e-care in some situations during your time at Hot Springs?
I personally did not use e-care, but it is available in their rooms. Or I'm sorry, that is incorrect. We did use it once we had a patient that came in with suicidal ideation, and with that, um, they had an e-care visit. It pulls up on the screen, and it was a visit with a mental health provider to do an assessment, and then they were there with us for a few hours while we were waiting for a facility to try to accept them, which mental health is very tricky, especially on that side of the state where there are very few facilities that accept mental health cases. So we had to wait for that and then try to find a facility that um, would take them. But yes, we did utilize it for that. And then they do utilize it a lot, especially on night shifts where the nurse is the only person. For traumas and stuff, they can pull someone up to help in, they can pull up physicians, they can pull up pharmacists, or just an extra person to chart things while they're doing everything, or to assist in dosage calculation, um, have any other ideas of what to do, stuff like that. So,
Thank you. Um, Retha is asking, where nurse practitioners work at the hospital? She's wondering if there were only nurse generalists or CRNPs.
mm, I am not sure about that. There are very few physicians that are in the hospital. They're like on the hospital side. There are few, very few. There was a few uh, NPs that were in the emergency department side that were on for the days, but there also is contracts with other, or I guess they have contracted physicians as well that come in for the emergency department to try to keep or to have someone there all the time that they also will go back and forth to other hospitals. But as far as the hospital side, there were only physicians that I saw. And there's usually just one.
You froze for a minute, Allison. You said, and there's usually just what?
What? Sorry.
At the end, you froze. You said there's only at the hospital. There's only what?
In the hospital, there's only one physician there at a time. They go
Perfect.
to
Thank you.
all the patients, um, and they have an office there, so it's really easy to get to them if you need them, and you always will be able to find them if you have any questions. So.
Well, thank you, Allison, for sharing your stories about your experience. It just really sounds like the nurses are very, very important to this facility. And so thank you for sharing your experience. And we're so glad that you were able to be there to help them. Great, great job. Well, the next town in South Dakota that we're headed to is to Tyndall, South Dakota. And I'll hand it over to Sophia to share her stories.
Hi, everyone. My name is Sophia. As Helene said, I was in Tyndall, South Dakota. I was at the St. Michael's Hospital there, which is located in Bon Homme County, which serves 3 different small towns in the area. It's a critical care access that serves about 1,000 people in Tyndall and the surrounding area. They have a 12-bed inpatient hospital with 2 emergency rooms and a clinic attached that operates during the daytime between like 9 and 5 p.m. They are Avera affiliated, which means that they can just outsource to the larger Avera hospitals in the area. And to kind of give you an idea of that, I'm originally from Sioux Falls, which is one of the bigger metropolis areas, as mentioned earlier, which has a population of 203,000 with 15 large capacity hospitals. So they'll outsource to Sioux Falls. They'll outsource to Sacred Heart in Yankton, which is about 30 or 40 miles away from Tyndall. And they also have an EMS service in Tyndall. So the ambulance will go out to the surrounding area if there is somebody that's on a farm that needs help or anywhere else in the area that a ride is needed to our place. On the clinical side, we have a pharmacy, there's physical therapy, there's all sorts of services that are offered. They also do have small surgical procedures offered every other Thursday. They do colonoscopies for the area. So people who need to get a colonoscopy for a procedure or something else, if they're just getting checked up or whatever, they can schedule it there instead of having to outsource to the larger hospitals in the area. We served a unique population for the area. There is an aging population in Tyndall. I would say that the average age in Tyndall is around 50 to 55 years old. So a lot of older people coming in with problems related to that, whether it's urinary incontinence, cancer, chronic diseases, things like that, infections that just won't go away. We dealt with a lot of that there. We also took care of a lot of prisoners from the Springfield prison, which is about 20 miles away from Tyndall. They came to us. I don't know if there was a partnership with Springfield or if it's just easier because the larger hospital in Yankton, Sacred Heart, is busy. I think that it's a combination of both, but we got a lot of the prisoners if there wasn't an emergent issue where they were needing like an emergency surgery or something, they came to us. So took care of a lot of different people there. Um, Usually when you're working, you work with 4 nurses on daytime with 1 patient care tech and a healthcare provider. And at night, it goes down to 2 nurses and a patient care tech, and the healthcare provider is on call. The team is really collaborative there. So they work a lot with pharmacy, physical therapy, occupational therapy, anybody from the clinic that they need to involve, they're all there for our patient rounds at 9, and everybody talks about the cases and really knows what's going on with the patients. So it's very involved care. Tyndall also offers the swing bed service, and that's what a lot of my longer term patients were swing bed for rehabilitation, either to get them to a different housing facility or to get them back home. One of the most memorable patients that I had there was a rehab patient. He was a local man there who had a leg amputation. This was something that was unexpected. They didn't know that this was going to happen. He just woke up and they had to perform an emergency amputation, and there's no more leg there. So they brought him to us for about 4 weeks. And it was really cool getting to see not only physical therapy and occupational therapy work with him and get his strength back, but also the nursing staff had a pretty large hand in rehabilitating this man and not only instilling the strength, but the confidence back into him to get him back home and have him feel like an independent person again. So it was a really cool experience. And if you're ever considering rural, I would highly encourage, if not a rural job, a rural experience in any area around you.
Thank you. Does anyone have any questions that they would like to ask Sophia?
Sophia, you had mentioned before about the unique populations, and I think you also talked about how they served some people from the a local Native American reservations as well.
Yes. There, as mentioned, I believe there's 6 reservations in the state of South Dakota. That also means that the states that surround us have a handful of reservations as well. And across the border from Tyndall, which is pretty close to the South Dakota border, is the Santee Reservation in Nebraska. And I looked it up, and Santee is about 45 minutes or 35 minutes from Tyndall, but it's an hour, if not more, from Yankton. So we got a lot of people from the Santee Reservation coming in, and that was another unique population that we handled. And when it comes to different marginalized populations like that, sometimes providers can be a little negligent or dismissive of their cases. And we worked with people that were really great and avoided doing that most of the time. And if there ever was an issue, there was always another provider or nurse to step in and advocate for the patient. I know there was a handful of times that we did that, but just handling the problems that come along with that, whether it's expense wise or location or the comprehensibility of the information that we're giving them, it's all involved in that patient care. And I feel like those experiences made me more aware as a nurse and also just not as judgmental because that's not what we're there for. We're there to treat the person, not what they're coming in with that's affecting their life otherwise. So
Thank you for sharing that, Sophia. What a unique population at this small rural hospital, not only caring for the people in their rural community, but then also from another state, and then also from a population from a state prison setting as well. Thank you for sharing those experiences. So the next place in South Dakota that we are moving to is to Vermilion, South Dakota, which is actually the home of our University of South Dakota here. But Vermilion is a rural community. So Parker, we're anxious to hear about your experiences, and I'll hand it over to you.
Hello, my name is Parker. As Helene mentioned, I was in Vermilion for my immersion time, and we have the university in town. I'm a 4th semester nursing student at the university, so I was lucky enough to do my immersion time in the town that I currently reside in. I'm originally from Worthing, South Dakota, which is about 15 minutes south of Sioux Falls. Vermilion is in the southeast corner of South Dakota, and it has a population of about 11,800, and that's during the summer months. So during the school year, the population pretty much doubles with all the people from the university coming to town. The university brings a lot of different ethnic groups to Vermilion that we wouldn't normally see without the university in town. So I got to experience a lot of different cultures during my immersion time. Vermilion has a higher than average poverty rate, sitting at about 25%. And I saw this reflected in my time in the hospital, especially in the emergency room. A lot of the patients there that came in were on Medicaid and they were worried about billing and being charged for different things. It was a pretty hot topic in the ER. A lot of people were worried about paying for medications and such that the providers were ordering when they came in. With the ruralness of the town, I noticed that the nurses knew their patients very well, and they had either taken care of them before or taken care of their family members, and they had a really good relationship with their patients and their families. And this really helped with the aspect of person-centered care and being able to have that relationship with your patients. I noticed that when the nurses were talking to the patients, it sounded more like friends talking, and it helped a lot with the patients being able to speak up about their treatment, asking, they felt more comfortable asking questions and being really involved in their care. The hospital in Vermilion is one of the few rural hospitals in the state that still deliver babies. There was 3 providers who delivered babies, and they had about 8 babies per month. I was able to help with a delivery from the time the mom came into the hospital until a couple hours after baby was born. And being able to experience that labor and delivery, postpartum, and nursery experience really confirmed my interest in labor and delivery.
Thank you. Any questions for Parker?
Parker, what do you think was the biggest advantage to for nurses to work in a small hospital like in Vermilion, either for them or for you? What do you think was the biggest advantage of working in a small rural hospital?
I would say definitely being able to not focus on one specific disease process or part of the body, like being on palm or cardiac. I would, if I had not done the HRSA experience, I would have never really considered rural because I didn't really know too much about it. I had only experienced the big Sioux Falls hospitals on very specific floors. So I really think that the nurses that work in rural settings have a big advantage of being able to have a much broader um, focus and professional
Yeah,
thinking.
get exposed
Yeah.
to a lot more areas.
Yes, yeah.
Yeah, yeah. No, that's, I can see why that would happen. That's a perfect example. And then do those nurses there, so the nurses on the med surge floor, then if someone comes in the ER, they go there as well? Or is that different staff?
There's one, I was working nights, so there was one nurse in the ER and one nurse on the floor, but there were a couple times that we had to go over to the ER when they had a more difficult patient to deal with and help out.
Perfect. Okay, thank you.
Thank you, Parker, for sharing your stories from Vermilion, South Dakota. And even though it's the home of our university and we have over 10,000 students in our university, Vermilion itself is a rural population and very unique in its healthcare and access to healthcare and challenges. So thank you, Parker, for sharing your story. The next slide that we're headed on to is we're just going to have a little discussion about some of the challenges in healthcare delivery in the South Dakota rural communities. And the topic that we're going to just talk about a little bit is the access to quality care And as you have heard from these stories, the number of clinics are very limited. The hours that the clinics are open, the local healthcare clinics during the regular hours are limited, and the number of providers are also limited. And so therefore, and I think we've heard it from each one of our presenters today, that there is an overusage of the emergency department, because many times clients are getting their primary care in the emergency department. So I'm just going to ask our students, did you see that when you were working in the emergency department, that that's where people went for their primary health care? And if you could share any of that, what you saw there. I see, Sophia, you're nodding your head. So what did you see?
People in Tyndall, and it's not only Tyndall residents, it's a wide array of people. If it was an emergency room visit, it also potentially could have been conducted during clinic hours, but not everybody knows that. We got everything from like a nicked lip while they were shaving to like broken arms to my child hasn't had a bowel movement in a day to severely dehydrated people and diabetic ketoacidosis. So you never knew if it was a true emergency or not. You kind of just had to sit and check them out and figure out what was actually going on with them. But I think that one of the challenges in rural healthcare is overuse of critical care services, because people are either uneducated about how a clinic actually works, and the difference between like walk-in and appointment and what like constitutes as an emergency room visit, or just like it's easy and it's accessible. So definitely, I think in my experience, I was also in Canton last summer, like emergency room visits are the majority of how we end up admitting people and doing other things like that.
Yeah, I agree as well with my experience in Canton. We did have a lot of patients that came to the emergency department for things like colds and some general upper respiratory ailments, sore throats, flu symptoms, things that normally we wouldn't think qualified as an emergency room visit. But one thing I think that might precipitate this is that the rural community tends to have a lack of um, the farmers, at least, had a lack of health insurance. Many of them were not insured. And I know it's kind of common knowledge that if you go to the emergency department, you will get treated and seen and not have to provide a form of payment at the type of time of service. So I feel like that did play into it.
I would just add too, just from visiting so many of these facilities that students are going to, and having worked in a small rural facility myself, just the distance to get anywhere, and especially in a state like South Dakota where there's a lot of wind and a lot of storms and a lot of snow. There are many times when people need health care and they just simply can't get to it because they can't afford gas, or they can't get to it because of the weather. And so then they delay treatment. And so by the time they come in, they're much sicker than they would have otherwise.
All right. Well, thank you for sharing your stories about some challenges that we see with rural healthcare and the delivery of healthcare. But again, thank you so much to the USD nursing students that participated in this experience and was there to provide care to these vulnerable populations in rural South Dakota. It's greatly appreciated. And thank you for sharing all of your great experiences with us today.
I would love
Thank
to echo
you.
those sentiments. And thank you, Dawn and Helene, for sharing your input as well. and for allowing us to bring your grant immersion experiences to the wider community. Before we sign off for the day, no, it's getting to the top of the hour. I just want to offer the opportunity for any additional questions that any of our audience might have, either for our faculty or for any of our nursing students. Please keep in mind that we have recorded this session, so we will be posting this likely towards the end of the week. Well, I guess it's Thursday, so tomorrow. If there's anything that you would like to revisit, or we also encourage you to share it with others in your network who may benefit from this, especially your students. I do see a question coming through. Retha is asking, was telehealth utilized often?
I can share super quick. We use telehealth for a few different things. And for our gentleman who was in for the rehab that I was talking about earlier, he had a specialist that was in Sioux Falls for infectious disease control that we would telehealth often. And we also had services where like they could literally like listen to them with a connected stethoscope, and they could see the EKG if that was performed and everything on screen and communicate with us in real time. So I know that we use telehealth very often because our providers were either nurse practitioners or somebody else who maybe did not have the specialty that was needed. So
thank you. Anyone else have an experience they are interested in sharing? Any other questions? And please also keep in mind that by visiting the GRNEN website, once you're logged in, if you go to our open forum community, you can feel free to ask any additional questions. We are all members of our community. You can also connect directly with anyone on the call today and direct message through that. If you have a question and you're having trouble using that as a solution, you can email me directly at info@grnen.org with any questions, and we can connect you back to our presenters. So with that, I would like to once again thank you for taking the time out of your schedule. We wish you a wonderful day or a wonderful evening, and we look forward to connecting with you in the future at another session. Thank you, everyone.